Pneumonia is a serious infection, a formidable foe that can significantly impact your respiratory health. It's not something to take lightly, as its effects can range from uncomfortable to life-threatening. Understanding what pneumonia is, how it affects your body, and what you can do to protect yourself is crucial for maintaining your well-being. That targets the lungs, our body's essential breathing organs. These vital organs are responsible for taking in the oxygen we need to survive and expelling carbon dioxide, a waste product of our metabolism. Without healthy lungs, our bodies cannot function properly, and our overall health suffers. Picture your lungs as spongy organs filled with tiny air sacs called alveoli. These alveoli are the workhorses of your respiratory system, facilitating the critical exchange of gases that keeps you alive and energized. They are incredibly delicate and efficient, designed to maximize the surface area for this exchange, where oxygen enters your blood and carbon dioxide leaves. This intricate process ensures that your blood is constantly replenished with oxygen, which is then transported to every cell in your body. Simultaneously, carbon dioxide, a byproduct of cellular activity, is removed from your blood and exhaled. Pneumonia disrupts this vital exchange, throwing a wrench into the delicate balance of your respiratory system. It compromises the lungs' ability to perform their essential function, leading to a cascade of negative effects throughout the body. By causing inflammation and filling the alveoli with fluid or pus, this buildup of fluid makes it difficult for oxygen to reach the bloodstream, leading to shortness of breath, coughing, and other respiratory symptoms. The inflammation further damages the lung tissue, hindering its ability to function effectively. Imagine a sponge meant to hold air suddenly soaked with water. The sponge's ability to absorb air is severely compromised, and it becomes heavy and waterlogged. This is analogous to what happens in the lungs when the alveoli fill with fluid due to pneumonia. It can't function properly. The waterlogged sponge is no longer able to perform its intended task, just as the lungs affected by pneumonia struggle to facilitate the exchange of oxygen and carbon dioxide. This fluid buildup blocks oxygen from reaching your bloodstream, depriving your body of the essential fuel it needs to function. The lack of oxygen can lead to fatigue, confusion, and even organ damage in severe cases, which can affect your entire body. Every system in your body relies on a constant supply of oxygen to function correctly. When pneumonia disrupts this supply, it can have far-reaching consequences, impacting everything from your brain to your muscles. Pneumonia isn't just one illness. It's a complex condition with various underlying causes and presentations. It's more accurate to think of it as a category of lung infections, each with its own unique characteristics. It's a group of lung infections caused by different germs, including bacteria, viruses, and fungi. Identifying the specific germ responsible for the infection is crucial for determining the appropriate course of treatment. Severity ranges from a stubborn cold with mild symptoms like a cough and fatigue to a life-threatening emergency, requiring hospitalization and intensive care. The wide spectrum of severity underscores the importance of seeking medical attention if you suspect you have pneumonia, depending on the germ, your age, and your health. Certain populations, such as young children, the elderly, and individuals with underlying health conditions, are at a higher risk of developing severe pneumonia. For some, it's a bad cold, a temporary setback that can be managed with rest and over-the-counter medications. For others, it's a crisis needing urgent care, demanding immediate medical intervention to prevent serious complications. Understanding pneumonia's variability is key to proper diagnosis and treatment. Recognizing the potential severity of the infection and seeking prompt medical attention are crucial steps in ensuring a positive outcome. It's a global health threat, impacting communities around the world, regardless of socioeconomic status or geographic location, affecting millions each year, placing a significant burden on healthcare systems worldwide. The sheer number of cases highlights the importance of prevention and early detection efforts. Pneumonia is not just a flu complication. While the flu can sometimes lead to pneumonia, it's important to understand that pneumonia can also occur independently. It's a distinct, serious condition, requiring its own specific diagnostic and treatment approaches. Confusing pneumonia with the flu can lead to delayed or inappropriate care. Learning how it works helps us protect ourselves and those we care about. By understanding the causes, symptoms, and risk factors associated with pneumonia, we can take proactive steps to minimize our risk and safeguard the health of our loved ones. Knowledge is the first step toward prevention and early detection. Being informed about pneumonia empowers us to make informed decisions about our health and seek timely medical attention when necessary. By understanding pneumonia, we lay the groundwork for effective recovery. Knowing what to expect during treatment and how to support your body's healing process can significantly improve your chances of a full and speedy recovery. Don't underestimate this respiratory intruder. Pneumonia is a serious illness that should not be ignored. Stay informed, stay vigilant. Proactive awareness and preventative measures are your best defense. Your lungs and your life depend on it. Taking care of your respiratory health is an investment in your overall well-being and longevity. Pneumonia, a potentially serious infection that inflames the air sacs in one or both lungs, can strike anyone, regardless of age, gender, or background. It's a condition that doesn't discriminate, affecting individuals from all walks of life. However, while anyone can contract pneumonia, some people are at much higher risk than others. Certain factors and conditions can significantly increase an individual's susceptibility to this respiratory illness. Infants and young children, particularly those under the age of 2, have immature immune systems that are still developing. This makes them especially vulnerable to infections like pneumonia, as their bodies are less equipped to fight off invading pathogens. Their developing lungs are also more susceptible to damage. Adults over 65 face increased risk as well. This is because, as we age, our immune defenses naturally weaken with age, making it harder for the body to combat infections effectively. The elderly are also more likely to have underlying health conditions that further compromise their immune systems. Chronic illnesses like asthma, which inflames and narrows the airways, diabetes, a metabolic disorder affecting blood sugar levels, or heart disease, which weakens the cardiovascular system, add extra strain on the body. This makes it harder to fight off infection and increases the risk of developing complications from pneumonia. People with weakened immune systems, such as those undergoing chemotherapy for cancer treatment, which suppresses the immune system, transplant recipients who take immunosuppressant drugs to prevent organ rejection, or individuals with HIV, which attacks the immune system, are at even greater risk of contracting pneumonia and experiencing severe complications. For these groups, pneumonia can quickly become life-threatening, requiring intensive medical care and potentially leading to serious health consequences. Lifestyle choices matter too. Smoking damages lung defenses, impairing the respiratory system's ability to clear out harmful substances, and excessive alcohol consumption weakens immunity, making the body more vulnerable to infections. Smoking paralyzes the cilia in your airways, the tiny hair-like structures that help remove mucus and debris. This makes it easier for germs to invade the lungs and cause infection. Even healthy people can get pneumonia, especially after a bout of the flu or a cold. But knowing your risk factors and understanding your susceptibility helps you take appropriate precautions. Recognizing these risk factors is crucial for prevention and early intervention. If you or someone you love falls into a high-risk group, be extra vigilant about protecting yourselves from infection. Take proactive steps to protect your lungs and overall health. Vaccination against pneumonia and the flu, practicing good hygiene such as frequent hand washing, and maintaining healthy habits are your best defense against this potentially serious illness. Stay alert to potential symptoms of pneumonia and act quickly by seeking medical attention if they appear. Protecting those at risk starts with awareness, education, and proactive prevention strategies. Pneumonia is caused by germs invading the lungs, most often bacteria, but also viruses and fungi. Streptococcus pneumonia is the most common bacterial culprit, causing sudden severe illness. Other bacteria and viruses like the flu or RSV can also trigger pneumonia, especially in children and older adults. Viral infections can damage lung tissue, opening the door for secondary bacterial infections. Fungal pneumonia is rare and usually affects people with weakened immune systems. Germs enter the lungs through inhaled droplets from coughs or sneezes, or by touching contaminated surfaces. Hospital-acquired pneumonia is especially dangerous, often caused by antibiotic-resistant bacteria. Knowing the cause helps guide treatment and prevention. Understanding how pneumonia spreads is key to stopping it. Pneumonia's symptoms can range from mild, almost like a common cold, to severe and life-threatening, depending on the type of pneumonia you have and your overall health. It's important to pay attention to your body and recognize the potential warning signs. While the presentation of pneumonia can vary, some signs are classic and should prompt you to seek medical advice. Recognizing these early can make a significant difference in the course of the illness. A persistent cough, often one that lingers and doesn't seem to be improving with over-the-counter remedies, often producing green, yellow, or even blood-tinged mucus, is a common indicator of a potential lung infection. This mucus is a sign that your body is actively fighting off the infection. Fever, chills, and sweating are also frequent symptoms, signaling your body's intense fight against the invading infection. These are clear signs that your immune system is working hard to combat the illness. Fatigue and muscle aches can make even simple everyday tasks feel incredibly exhausting and difficult to accomplish. This overwhelming tiredness is a hallmark of pneumonia. Shortness of breath or rapid breathing, where you feel like you can't get enough air, is a red flag, a serious warning sign that needs immediate attention, especially if it happens even when you are at rest and not exerting yourself. Sharp chest pain when breathing deeply or coughing may occur, indicating inflammation in the lungs. In older adults, the symptoms of pneumonia can sometimes be subtle and easily overlooked, such as confusion, disorientation, or a general decline in cognitive function. They might also experience a drop in body temperature, which is the opposite of what you'd expect with an infection. Any sudden change in mental state or behavior in the elderly should be taken very seriously and evaluated by a medical professional promptly. Difficulty breathing, especially if it's severe or sudden in onset, always requires immediate medical attention and a trip to the emergency room. Don't ignore these warning signs, especially if you are in a high-risk group. Early recognition and prompt treatment can save lives and prevent serious complications. If your symptoms worsen, persist, or don't improve after a few days, it's crucial to seek medical help. Listen carefully to your body's alarm bells, and don't hesitate to seek professional medical advice. Preventing pneumonia is possible and powerful. Vaccines protect against major causes like pneumococcus, flu, and COVID-19. Annual flu shots and staying current on all recommended vaccines are essential. Good hygiene, frequent hand washing, covering coughs, and avoiding face touching reduces risk. Don't smoke. It damages your lungs' natural defenses. Eat well, exercise, and get enough sleep to keep your immune system strong. Manage chronic conditions with your doctor's help. Prevention starts with simple, consistent habits. Diagnosing pneumonia starts with your doctor asking about symptoms and risk factors. A physical exam includes listening to your lungs for abnormal sounds. Vital signs and a pulse oximeter check your oxygen levels. A chest X-ray confirms the diagnosis and shows the extent of infection. Sometimes, blood tests or sputum samples help identify the exact germ. In severe cases, a CT scan may be needed. Quick, accurate diagnosis guides the right treatment. If you're at high risk or symptoms are severe, don't delay seeking care. Early diagnosis means better outcomes. Treatment depends on the cause. Bacterial pneumonia needs antibiotics, while viral cases require supportive care. Always finish your antibiotics as prescribed to prevent relapse and resistance. For viral pneumonia, rest fluids and fever reducers are key. Antivirals may help with flu-related cases. Most people recover at home, but severe cases may need hospitalization for oxygen or IV antibiotics. Hospital care is vital if you have trouble breathing, confusion, or low oxygen. Recovery can be slow. Fatigue may last weeks. Follow your doctor's advice and don't rush back to normal activities. A follow-up X-ray may be needed to confirm recovery. Patience and self-care are essential for full healing. Listen to your body and prioritize rest. Some symptoms mean you need urgent medical help. Severe shortness of breath, chest pain, high fever, or coughing up blood are emergencies. In older adults, confusion or a drop in body temperature are serious warning signs. Don't wait. Seek help immediately if these occur. Trust your instincts. Worsening symptoms need prompt attention. Early action can save lives. Pneumonia is a serious threat, but knowledge and action make a difference. Vaccination, good hygiene, and healthy habits are your best defense. Recognize symptoms early and seek timely care. Partner with your doctor for diagnosis and treatment. Recovery takes time. Be patient and follow medical advice. Protect your lungs by making informed choices every day. By understanding and respecting pneumonia, we can all breathe easier. Stay proactive, stay healthy.